Okay, so we'll get started. Tessa, you can start recording. So, good afternoon, everyone, and welcome. Today, you're joining us for a webinar entitled Addressing Basic Needs in Higher Education, Innovative Research and Policy to Support UC Student Success. This event is being recorded and is co-hosted by Kalahia and the Center for Economic Justice in Action. And the recording and accompanying materials will be emailed to attendees and posted on Kalahia's website after the event. So we encourage you in the format, please use the Q&A function throughout the webinar. We will have time at the end for questions. Next slide. So to introduce myself, my name is Denise Payan, and I'm a health policy researcher and an associate professor at UC Irvine Josie Wentz School of Population and Public Health. I'm also the faculty director of Kalahia, or the California Initiative for Health Equity and Action, which is a statewide research and policy center that supports the translation of research evidence into state health policy and public health practice, with the ultimate goal of improving health equity here in our state and throughout the different regions. And so you can see our priority areas listed there. And to kick off, I'd really just like to thank Tessa Polito, who's our graduate student who's helped with organizing this event and logistics, and also to our school's communications team for their contributions. Next slide. And we're really thrilled to partner with the Center for Economic Justice in Action and their leadership. So thank you, Heather, Lisa, and Susanna for your partnership and work to put together this event. SAGE is committed to community-engaged research and programming that alleviates poverty, reduces economic inequality, and advances the essential needs of all people. And today, Dr. Heather Bullock will be moderating the research presentation after the policy remarks. And you'll learn more about an open call that exists right now to support research in the UC system to address students' basic needs. Next slide. And so today you're going to hear about pressing issues related to students' basic needs in higher education, as well as research findings and programmatic and policy responses that can help address these needs and ultimately support student success. And we're kicking off the event with policy remarks from Dr. Shana Charles, who's an associate professor in the Department of Public Health at California State University, Fullerton, and is also, where she wears many hats, is also mayor pro tem in the city of Fullerton. She earned her master's degree in public policy from UCLA Luskin School of Public Affairs, also has a PhD in health services from UCLA Fielding School of Public Health. Her own work focuses on discontinuous health insurance, particularly public coverage, and its impact on access to care and underinsurance. Dr. Charles also specializes in political issues related to state and national healthcare reform. And so in addition to her faculty role, she's affiliated with the UCLA Center for Health Policy Research and has actively led and disseminated key reports and resources to bridge the gap between research and data and policy. And so in her current role as Mayor Pro Tem, she's also served as chair of the Community Development Citizens Committee and helped to direct federal funds to fix roads, help homeowners, and provide mental health services to those without housing in the region. So we're really thrilled to start off this event with Dr. Shana Charles' remarks. So thank you for joining us.
Thank you. I appreciate the opportunity to be able to speak on this topic to this wonderful audience. I don't have any slides. I'm just going to be speaking here. So I started out at the UCLA Center for Health Policy Research, working with folks like Dr. Rick Brown and Steve Wallace and Jerry Kaminsky. And we were working on trying to get health insurance to be broadly accepted. This was, 25 years ago when California was really just starting its expansions. And then I became director of health insurance studies for the Center for Health Policy Research, and eventually got a tenure track job at Cal State Fullerton and brought that with me in 2015. So I've been there for 10 years. And I mention this because I brought this idea of health insurance as a basic need to this department. And it is something that I'm still kind of fighting for and working on. We do have now a basic needs center at Cal State Fullerton, like all CSUs and all UCs do. I was part of the implementation of that. One of our masters in public health students was part of opening up the first food pantry in 2017, 2018 that we had on campus. And, that's an important aspect of it. I've still been arguing about trying to get health insurance to be more spotlighted, but of course we do have a navigator there to help people enroll, not only in Covered California, but also in CalFresh and those other programs as well that you'll be hearing about later today. So I ran for office in 2022 for the city council. I do represent the district that I also work in. I represent the district that includes Cal State Fullerton. And I ran for it explicitly on a public health message. And I won. And I talked to people across the aisle. I didn't, it is a nonpartisan office. You don't have your party affiliation on the ballot. And I did knock on every door. And so people of all parties and no party preference all responded to this message of, I want every community in Fullerton to be healthy, heard, and heading in the right direction. And of course, those last two have to do with mental health too, right? So I've been very open about that and bringing a health and all policies perspective. I'm sure many of you know that health and all policies document from the American Public Health Association. I had been teaching it in my class, my health policy class for many years, and I really wanted to actualize it. And so what we see at the state level are great bills like AB 79 that was just signed into law that will strengthen those basic needs centers by making the local departments also have people that will be dedicated to working with the basic needs centers. And that's a big step forward, increasing communication and decreasing the silos. But at the local level, promoting things like at Cal State Fullerton, we have an arboretum that's a level 4 arboretum. It has wonderful fruit trees that grow fruit. And we have a program that connects that arboretum to our local food pantries, not just the one on campus, but also the ones for the broader community, as well as a restaurant that employs people who are former foster youth and gives them housing support along with employment opportunity and skills in the restaurant industry. So all of these things intersect, and you can use both tools, the policy side at the local and at the state level, along with promoting public health and making sure that elected officials who vote on these things understand the importance of public health. Another thing that was mentioned was homelessness. And real quick before I go, I want to say that was another place where I was able to have a real impact just by sitting in these seats. When I was chair of the Citizens Committee, that was before I was mayor pro tem, but when I was chair of that committee, one of the staff members came and said to the committee that she would like to put some of the money towards something called a Hope Center, which was homeless outreach proactive engagement. That's what HOPE stood for, to be able to actively go out and talk to homeless people and be able to get them into shelters with this centralized system. And because I was chair of that committee, and I said, well, I know from public health research that this is a great idea. This is a very public health based idea. Let's take the services to the people. And I promoted it. We were able to get it done. I don't know if it would have happened if I hadn't been there to say, this is a wonderful thing. And now that Hope Center, 6 years later, is doing great work for the entire North Orange County region. So I just want to thank all of the researchers for being here who have already done such great work, and to thank those of you that are going to go on to do some great work. And please feel free to contact me in either of my capacities, whichever is appropriate to you at the time. And think of me as someone who can help you along this path as well. And I would really like to encourage all of you to get involved at the commission level in cities and counties. They both have commissions. You get appointed to those. You don't have to run for office or to even run for office if that's something that you're able to do, because really we need more people in public health to hold these seats and have that perspective. Thank you so much.
Thank you so much, Dr. Charles, for all that you're doing, for your time and remarks. I was thrilled that you could join us. In part to this is a level of encouragement, engagement, and policy. And just I think especially now we need stark reminders of practice and research and data, and this going hand in hand. And I think elevating partnerships across institutions and across the state. So thank you so much, Dr. Charles, for joining us. For these remarks. We're really inspired by your extensive health policy work in the state and the region. So moving on to today, I'd like to introduce our primary moderator, Dr. Heather Bullock, who is the director at SAGA right now and is at UC Santa Cruz, but also is the research and evaluation co-director for the UC Essential Needs Research Training and Promising Practices Consortium, and is a professor of psychology and a community engaged psychologist who's in her own right has really established and contributed to examining women's pathways in and out of poverty and homelessness, experiences with public assistance programs, and how classism, racism, and sexism influence policy attitudes and treatment of low-income women and families, and has authored multiple books and articles on these topics. And Also so served leadership positions in, as I learned, academic professional societies, and earned her policy chops as a congressional fellow with the U.S. Senate Committee on Health, Education, Labor, and Pensions. And so it's an honor to have you in this role as director and to be moderating the event today. So I will hand off the virtual microphone at this point to her for the next phase of the event, when she'll describe a little bit about the request for proposal, but also so you could learn more about the Center for Economic Justice in Action and the UC Essential Needs Consortium. So thank you, Dr. Bullock, for your role.
Well, thank you so much. Thank you for that generous introduction, and welcome everyone. It is absolutely wonderful to be here with you today. A giant thank you to the California Initiative for Health, Equity, and Action, especially Denise and Tessa for bringing this event to fruition, to Dr. Shana Charles, to our presenters, and to everyone joining us today. High rates of basic needs insecurities among U.S. college and university students undermine health, well-being, retention, and success. A National Hope Center survey of more than 74,000 students found that 41% experienced food insecurity, 48% housing insecurity, and 14% homelessness. Basic needs challenges are also pervasive across the UC system. An estimated 48% of University of California undergraduate students and 35% of UC graduate students are food insecure. Rates of food and housing insecurity are particularly high among students with structurally marginalized identities, including parenting students, former foster youth, first-generation students, low-income students, students of color, Pell Grant participants, and members of the LGBTQ+ community. Over the past 15 years, the University of California has been at the forefront of state and national student basic needs initiatives. Housed at the Center for Economic Justice and Action, CEJA, at UC Santa Cruz, is the UC Essential Needs Consortium, which unifies training, education, research, and evaluation under one roof, bringing together UC practitioners, faculty, researchers, and staff in new, innovative ways to advance students' basic or essential needs. This important work is funded by the UC Office of the President. Next. Our work embraces the University of California's comprehensive conceptualization of basic needs as encompassing an ecosystem that supports financial stability by ensuring equitable access to nutritious and sufficient food, safe, secure, and adequate housing to sleep, study, cook, and shower, healthcare to promote sustained mental and physical well-being, affordable transportation, resources for personal hygiene care, and emergency needs for students with dependents. We use the terms basic and essential needs interchangeably, but encourage use of the term essential needs to reinforce their crucial role in thriving and student success. Next slide. Today, we will learn about findings from 3 of CEJA's UC Essential Needs Grant awardees. We have funded 12 incredible projects thus far, totaling more than $1 million in grant funds. Our program supports research across the UC system that advances understanding of UC students' essential needs and identifies effective strategies and programs for better meeting them. We welcome proposals from a range of disciplines and methodologies. Next slide. Our call for proposals is released biannually in the fall and the spring, and our current call has a submission date of November 6th. And we hope that today's presentations will spark your ideas and interests in learning more about this opportunity. The call for proposals is available in the resources accompanying this event. The importance of food security is a theme that runs through today's presentations. Food security refers to consistent access to enough food for an active, healthy life, including the availability of nutritionally adequate, safe food at all times, and the ability to acquire food in socially acceptable ways, for example, without scavenging or other coping strategies. Low food security is characterized by reduced diet quality, variety, or desirability, and very low food security includes multiple indicators of disrupted eating patterns and reduced food intake. The findings from today's presentations will lend much needed insight into food insecurity and other basic needs challenges, as well as concrete strategies and policy recommendations for addressing them. I am delighted to introduce our first presenter, Dr. Susana Martinez, Associate Professor of Epidemiology and Biostatistics at UC San Francisco. Professor Martinez's research focuses on connections between food insecurity, basic needs, sleep, mental health, and physical well-being among college students. She's committed to improving health outcomes by identifying structural barriers and targeting upstream social determinants of health. I am incredibly fortunate to co-direct the UC Essential Needs Research Grant Program with Dr. Martinez, and she leads our system-wide evaluation efforts. Her presentation today focuses on exploring the SNAP application process for college students. So let's give her a warm virtual welcome.
Okay, I totally forgot to turn on my camera. Hello, everybody. Thank you, Heather, for the lovely introduction. And good afternoon, everybody. Today, I'm going to be talking about exploring the SNAP application process for college students. So just for a little bit of national landscape, Heather went over some of it, but just want to reiterate that currently research shows that up to 40% of college students experience food insecurity in the nation. That's compared to about 14% last seen in the US population. Currently, there are 19 million college students, of which 3.3 million are SNAP eligible. However, most are not enrolled. In California, SNAP is administered as CalFresh, and we've been working at the state level to support strategies to reduce food insecurity in public higher education. To date, the state has committed 19 million to each the UC and the CSU system. Yes, to the UC and CSU systems. And in the UC system, we've mainly been focusing on food pantries across the system, as well as CalFresh outreach and assistance. Some of the slides got a little wonky here. So prior to the pandemic, there were many stories about the confusing SNAP application process for college students, including the unscheduled yet required interview and all the verification documents that go along with the application. Once the application gets to the state level, there's a ton of administrative burden that happens on the other end of things. And there are 58 counties in California, so a lot of inconsistencies in how SNAP is administered, as well as how the exemptions are interpreted, which sometimes can lead to wrongful denials in one county versus not in another county, which means that students ultimately have to reapply. One of the facilitators to CalFresh, to a successful CalFresh application for students has been a strong county campus relationship, which has proven to show that it's easier for students to get through the application process when that relationship exists. Yeah. Okay. Okay. So during the pandemic, we saw kind of a natural experiment where things were the application process was streamlined. There were verification and interviews were all waived at the state level, and then there were federal level modifications. Next button, or need the last part of the. Yeah. Thank you. And after the pandemic in California, we passed an assembly bill requiring campuses to submit lists of programs that increase employability, such as nursing programs, teaching programs, dental programs, et cetera, and essentially to qualify students to apply for CalFresh for those students who met income eligibility. However, while all these changes have been happening at the federal and state levels, there's still little understanding of the process from the student perspective. Next slide. In the summer of 2024, we conducted a mixed methods study with 58 students across 6 UC campuses. We conducted 6 focus groups with undergraduate and 6 with graduate students. We found we had mainly we had a 50-50 undergraduate graduate sample who were on average 21 and 28 years respectively. Most participants in the study were cisgender women. Next button. And we had most of our participants were first in their families to go to college, as well as receiving state or federal financial aid. And next slide. From our survey data, we found that over half of our students were receiving benefits. But two important findings that we did find was that students that almost half or over half of our students were had either missed their 6-month recertification or their 12-month recertification documentation that they have to submit every 12 or 6 months, which is a really big concern because once students miss that deadline, they have 30 days to submit the documents that are required, and they don't know they have 30 days. So that means they end up falling off the program, and then they have to reapply all over again. Next slide. Okay, so from the focus group data, we found 4 themes. The first theme being that campus basic needs, CalFresh, support, and online technology improve the application process. So basically, in this quote, we had a student who'd gone to the Basic Needs Center, a staff member there who's trained on CalFresh, provided them a checklist of all the things, documents that they had to submit with their application. Once a student had all of those documents gathered, they would set up a Zoom meeting, and then using screen share, the basic needs staff person would help the student through the application process, therefore eliminating any kind of confusion, making it really easy, and ultimately the student succeeding and receiving benefits. And so this is a model that's been implemented across many of the UC campuses, and mainly came out of the pandemic. Next slide. The second theme was that SNAP benefits support students' overall well-being. We found that SNAP allowed students to purchase more nutritious and diverse foods, with one student saying that they were able to have a well-balanced meal and not just a cup of noodles kind of meal. We also found that SNAP reduced financial stress and improved mental health. So when money was scarce, it was helpful to know that students had a little bit of money through their benefits that was just, going to food. And so students talked about this in a way that that really did sound like that SNAP benefits were giving them peace of mind. And lastly, there was an unknown perk to the EBT card, which is where how you use your benefits. And basically, the card provided access to additional health and financial recreational resources, such as discounts on utilities, Wi-Fi, and as well as other things like free admission to the zoo and museums and exhibits. Next slide, please. So the third, I'm going to take a sip of water. The third theme was that students learned about SNAP from family, peers, and campus networks. So basically, from their friends who'd already been on the program, or from their roommates, from basic needs staff. In this one particular situation, a student had heard about it through their brother who was on CalFresh when they were a student. So the brother took the student over to the county, and right then and there, they spoke with a representative and set up that student with benefits. Next slide. The last theme was unreliable county communication, which placed burden on students and also potentially delayed access to SNAP. So there were 3 different themes to this one. And mainly what we found was what we had already heard about, which was the unpredictable interview phone call, which students often missed, and then, had to figure out how to reschedule again. And so when they did that, they found out that the county was very inaccessible, excessive wait times in terms of getting in touch with somebody at the county, students talking about waiting up to 2 hours. In one situation, a student had waited 2 hours, their phone died, and then they had to call back and wait all over again. So really highlighting how difficult it is to get through to the county, especially when it's something related to your application. Next slide. Sometimes students would just take, destiny into their own hands. And so they would resolve the long delays in receiving their benefits or try to figure out where their application is by just going to the county. And kind of small on this slide, but what you can see is that any one of our campuses is not very close to a county office. And so we had stories of students taking up to 2.5 hours one way to get to the county to figure out, where their benefits were, why their card was delayed. EBT cards sometimes could take weeks to arrive in the mail, as well as, just trying to figure out where they are in the application process. Next slide. So in conclusion, we found that Campus CalFresh assistance improved the student application process, application experience, especially because basic needs staff were trained to understand the nuances of the student eligibility rules. Having SNAP benefited students in various ways, nutrition-wise and mentally. On the downside, students frequently struggled to reach county agents, and then just receiving their EBT cards was also an issue, which ultimately all of these things resulted in delayed benefits. Next. So bottom line being that streamlining the process for students is fundamental to ensuring timely access. Next. So the policy implication from this research is that continued state funding is essential to support and expand SNAP for college students, as well as federal policy, which is needed to streamline the process. In light of HR 1, it seems like this might be very difficult to do, however, more important than ever. Last slide. Just like to acknowledge our student participants in the study, as well as our study team, our basic needs crew who helped us organize the research across 6 campuses, and then lastly to the UC Essential Needs Consortium for making this research possible. Thank you.
Thank you so much, Susanna, for sharing your work. I do want to encourage everyone to use the Q&A button at the bottom of your screen to submit questions, and there'll be time at the end for questions as well. We really want to welcome everyone's engagement, so please do not be shy. Our next speaker is Dr. Camilla Hostener, Associate Professor of Psychology at UC Davis. Professor Hostener studies how childhood poverty and other forms of early life adversity influence later development and health. Examining developmental processes at multiple levels of analysis, she incorporates endocrine, immune biomarkers, electrophysiological data, and behavioral measures. Professor Hostener is particularly interested in protective factors that buffer children and adolescents from chronic stress and subsequent physical or mental health issues. Today, she will discuss changes in food security and stress in recipients of CalFresh and AggieFresh. And we are so excited to hear from you.
Thank you so much, Dr. Bullock, for the wonderful introduction. It's really great to see you all and be with you today to tell you a little bit about our project conducted with graduate students Emily Skylar and Geneva Jost. Our project was focused on food security and stress in applicants of CalFresh and AggieFresh. If we could go to the next slide. As we've already heard from Dr. Bullock and Dr. Martinez, food insecurity is a major issue affecting U.S. college students. In fact, a recent meta-analysis of 156 studies shows that the prevalence of food insecurity on college campuses in high-income countries is between 42–43%, so very high. Food insecurity is defined as limited or uncertain access to adequate, safe, and nutritious food, or the ability to acquire such food in socially acceptable ways, and is often described in terms of severity according to this USDA food security classification groups that you can see on this diagram, ranging from very low food security to marginal food security, and high food security. And it's important to note that experiencing food insecurity is associated with 2.4 to 3.3 times higher odds of experiencing depression, anxiety, and other forms of psychological distress. So there's a very strong mental health burden. Next, in a previous pilot study that we conducted in 2024 with 300 undergraduate students at UC Davis, we examined chronic stress as a mechanism that connects the experience of food insecurity with mental health challenges, including anxiety and depression. We found that lower food security was linked to higher perceived stress, and higher stress in turn predicted more depressive and anxiety symptoms. Even after accounting for stress, we found that food insecurity still showed significant direct effects on depression and anxiety, indicating other pathways additional to stress. So stress explains some, but not all of the association between food security and mental health. And this led us to wonder about the role of having benefits like CalFresh or AggieFresh, and if access to these resources may reduce stress and moderate the link between food insecurity and mental health outcomes. So with support from the Center for Economic Justice and Action, we started a larger longitudinal project with 3 waves where we wanted to understand the student experience from application to receipt of benefits, exploring the effects of receiving or losing benefits, effects of waiting periods and accessibility challenges over a 6-month period. And so I'm going to share some results today, specifically tied to our goal to understand changes in stress and mental health as related to benefit access. And ultimately, we hope that the work will support evidence-based changes to improve and develop more campus resources. So we recruited students in the fall quarter of 2024. We had about 303 students in the first wave, and you can see we had pretty good retention. About 239 of them completed wave 1 as well as wave 2, which was 4 weeks later, and time point 3, which was 6 months after the start of the study. Students were invited by email to participate, and they completed questionnaires, and we followed them through the spring 2025 term. They completed a variety of different measures, such as the food security scale or module from the USDA, but also psychological scales on coping, perceived stress, sources of stress, measures of anxiety, depression, and loneliness, to highlight just a few. And some good news for the UC Davis Aggie Compass team, we found that a majority of students reported receiving their benefits within 30 days or less from application. Although this is good news, it presented some challenges for our design because we were thinking of the first time point as a baseline measure, but we also did have some students who changed status from not having benefits to having benefits over the course of the study. We had about 35 students who changed status. So this allowed us to see change over time. What's shown here are the percentages of students who have CalFresh, AggieFresh, or no benefits across time 1, time 2, and time 3 of our longitudinal study. If we want to go to the next slide, we wanted to focus on this primary research question where we want to see if there are differences in stress, depression, and anxiety as primary mental health outcomes between those who received benefits and those who never did. On the next slide, I'm going to show you the results for the perceived stress scale shown here on the y-axis. And then on the x-axis, we have 4 food security classifications: H for high, M for medium, L for low, and VL for very low food security category. So we looked at main effects of benefit status, as well as food security category, and the interaction between having benefits in food security category. So what we found here was that stress increases as food security worsens, with very low food security students reporting much higher stress levels than high food security students in that VL group. And when comparing between students who received benefits versus those who did not, we see that the benefits alone don't matter much for high food security students, but for very low food security students, there's a significant interaction between benefits and very low food security status, which shows that the students shown in green who have benefits have much lower levels of stress, compared to students who are not receiving benefits within that very low VL food security group. This suggests the benefits may buffer stress, as they report about 0.55 point less stress levels compared to their peers without benefits. On the next slide, we looked at the same analysis, but this time we have depression as an outcome. And you see, again, more depressive symptoms are reported by students in the very low and lower security group towards the right side of the chart. And then again, we also see somewhat of a buffering effect of benefits in the very low security group, where students who received benefits, shown in green, have fewer symptoms of depression than those who did not receive benefits, shown here in blue. Next, we looked at anxiety as our other primary outcome, and we see the same patterns where anxiety increases as food insecurity increases as we move from the left side to the right side of the graph. And we again showed that students in the very low food security group who received benefits, shown here in green, reported fewer depressive symptoms than those in the same group who did not receive benefits. Just a quick note that the sample size was smaller for that very low security group, but it's still notable that we see these consistent patterns across the 3 mental health outcomes we considered. Next, to summarize, these preliminary analyses suggest that benefits like CalFresh and AggieFresh may be buffering against higher levels of stress and negative mental health consequences like anxiety and depression for students who experience the greatest food insecurity. This leads us to propose some recommendations. Here, we're thinking that it's important to direct supports to students with low and very low food security, who appear to be most vulnerable to stress and mental health consequences. We'd also be supportive of initiatives to increase access to on-campus CalFresh application support, which we found from our qualitative data to be particularly helpful. We also are urging those who are attending today to really think about ways to envision programs that might combine economic and food assistance with mental health support, and thinking about expanding access to counseling services on campus, which are currently insufficient to meet the needs that exist. And with that, I'd like to thank the Center for Economic Justice in Action, AUC Santa Cruz, for funding this project, the UC Davis Aggie Campus for their partnership, and the students who participated in this research for their time and effort. And I would be happy to address any questions that you may have.
Thank you so much for sharing this important work. Our next presenters are Drs. Matthew Landry and Laura Enriquez. Matthew Landry is Assistant Professor of Population Health and Disease Prevention at UC Irvine's Joe C. Wen School of Population and Public Health. Dr. Landry's research focuses on identifying optimal diets for chronic disease prevention. He is particularly interested in behavioral interventions that promote plant-forward and plant-based diets, and is a passionate advocate for policies that address nutrition-related health inequalities in low-resource settings and communities experiencing health inequalities related to food insecurity and structural disparities. Dr. Laura Enriquez is Associate Professor of Chicano Latino Studies and Director of the Center for Liberation, Anti-Racism, and Belonging at UC Irvine. Her research focuses on the educational, political, and social experiences of undocumented young adults and members of mixed status families. She is the author of the award-winning book of Love and Papers: How Immigration Policy Affects Romance and Family, and the forthcoming book, Family Legal Vulnerability: How Immigration Policy Shapes the Lives of Latino College Students. And I will note that Dr. Denise Payan is a co-investigator of the work that they will be discussing today. Fulfilling the UC Promise: Strengthening Access to Essential Needs Services for Undocumented Immigration-Impacted Latinx UC Students. So please join me in welcoming them.
Excellent. Thanks, Heather. Let's move to the next slide. And so while we've talked about essential needs among college students in general, my colleague, Dr. Enriquez, and I will talk about a very unique student population that we have on our campuses. And that's immigration impacted students because they face unique barriers to accessing these essential basic needs. So these students, including undocumented individuals and those that might have more precarious legal statuses, often can't access federal financial aid, work study programs, or some of the public benefit programs like we've been talking about, like CalFresh. And beyond that, many of them might avoid seeking help or assistance due to concerns about their immigration status or maybe even their family member's safety. So this all creates a unique intersection where they have additional stress around accessing food, housing, and healthcare, and it makes it harder for them to focus on their academics. And so our work really moves in the direction of understanding what are the barriers to creating a supportive, inclusive campus environment for these students. Next slide. And so we'll be talking about two separate projects, which I think capture both the quantitative and qualitative aspect of these students' lived experiences. I'll be first presenting some data that we have from a survey that was conducted back in 2020 amongst almost 1,800 Latinx UC students across the UC system. And then my colleague, Dr. Enriquez, will focus on some more recent research that we did, where we did focus groups and interviews amongst 38 undergrads on our UCI campus. Next slide. Now, our quantitative research, our survey was really framed around a health equity framework. Now, many of us in kind of more of the public health settings might be familiar with the socio-ecological model. This is a slightly modified framework that captures some unique aspects. And one of the favorite ones that I like that it focuses on is the systems of power dynamic. But the physiological pathways, individual factors, and the relationships and networks that we typically see within a standard socio-ecological model are also present. Next slide. So one of our primary findings was that, like across the UC system, food insecurity is a significant issue. Amongst undocumented students, we saw rates of almost surpassing 60%. However, basic needs use amongst each of our groups was significantly lower than the need that is actually presented. So it really begs us to understand what are the barriers that are preventing these students from accessing the services that are available to them. Next slide. So overall, we did find that food insecurity is associated with more frequent use. It makes sense. But this wasn't the case for some of our students that were US citizens with undocumented parents. We did find that our immigration impacted students with higher perceptions of legal vulnerability used the Basic Needs Center more frequently, and that economic hardship was associated with more frequent use for those immigration impacted students. And the threat to family or social exclusion is associated with more frequent use for US citizens with undocumented parents. We also know that campus resources are critical to help encourage those immigration impacted students to use the Basic Needs Center. And this really highlights how the campus support services network is so critical in providing this safety net for students and connecting them with other resources that may be on campus. And we also found some unique findings when it really came around housing. Again, food is one aspect, but when students are struggling to put food on their plates, chances are they might be also struggling to meet some of their other basic needs as well. And one of those big things was housing, which will really be highlighted in our qualitative findings. Next slide. And now I'll pass things over to my colleague, Dr. Enriquez.
Thanks. So I'm going to talk a little bit about the focus groups and interviews that we did and thinking about what are key challenges to accessing these basic needs centers on campus, right? That we're not seeing maybe the differences that we expected in the quantitative data by immigration status. but rather really highlighting that legal vulnerability is encouraging, or not encouraging, but isn't preventing people from going necessarily. And that people that are food insecure are also going, right? So the centers seem to be performing the function that we would hope, but there's still some key challenges to accessing basic needs centers for these immigration impacted students. And one of those is a lack of awareness, right? So a lot of students were aware of the food pantry that was available through the Basic Needs Center, but not aware of the scope of the other resources that are available, right? So support with accessing things like the social workers or other supports available and other resources provided through the center, but really focused on the food pantry and CalFresh as things that they knew about that the center provided. But the other sort of piece of that is that there was a really lack of awareness where students remember learning about these Basic Needs Center, maybe at like an orientation when they first started at the campus. But in this case of this campus, right, a lot of students lived in the dorms and had food plans and other resources that, they didn't have kitchens. So there really wasn't a place for them to cook food that they would get from the Basic Needs Center. So when students ended up facing more food insecurity or insecurities later on in second, third, fourth, fifth years, they'd forgotten what they had learned about the Basic Needs Center, really getting back to this idea that we need to think about other ways of delivering this information. It also becomes important in thinking about the quantitative data. Students who lived off campus without family were more likely to be accessing the basic needs services, right? Because families might help them provide food that they need and eat communally, but also students that living on campus may have access to dining halls or other forms of support. But really, we're looking at these students who are living off campus on their own as a unique group that may be also a target group for this lack of awareness. Another piece of these challenges was limited hours and appointments. So there's an appointment system required at UCI to access the Basic Needs Center and the food pantry. And students would say things like this quote here, right? Their appointments book really quick, so I stopped going. I was like, you know what? Maybe others really are more hungry than me because the competition for these appointments was so strong. And I think that came out a lot in thinking about the competition. And then that sort of made students think about, maybe I'm not as needy as these other people that are trying to get this, and created sort of this resource hierarchy that students were having to manage. So these appointments were difficult to secure. They're incompatible with other commitments like work and class because they were in regular business hour kinds of times. And then they were also unsure if the desired food would be available. So students would talk about going, waiting, getting the appointment, and that not being able to get some basic things that they needed, and then having to spend more time to go and buy those things as well, right? So then really expanding the amount of time that they're going to have to spend securing groceries, to the consequence of maybe not being able to work to make up the money that they could have just paid to buy the groceries on their own. So trying to manage those trade-offs. There also was discussions about inconvenient locations and transportation needs. So it was difficult or time consuming to transport food either because there wasn't parking nearby. It was difficult to move it on the bus. It's located pretty far from housing. Oh, next slide. And then in terms of thinking about immigration related concerns, right, this is sort of another level. In a lot of cases, there was already existing institutional trust that helped students feel safer using campus resources. And I think this is why we don't see the status differences that we might expect, because being on campus, at least at this time period, curtailed deportation concerns. They didn't feel like they were sharing information with people that they shouldn't. And they were knowing that they were not accessing necessarily federal resources or things that would put them in danger of not being able to adjust their own or family members' immigration status in the future. And then in addition to that, there was a lot of discussion about undocumented students' ineligibility for SNAP or CalFresh, and wanting really clear eligibility statements because of the focus on that program. Students were applying and then having a lot of feelings about not being able to get it. Next slide. And then the last thing was limited concerns about social stigma. So few students, there's a lot of perception from staff that there is a lot of stigma, that folks don't want to be seen at the center, which was not an issue that students felt. So a few expressed concerns about others seeing them at the center. saying that, I grew up in poverty. I feel that shame went away a long time ago. Like they are used to having to access resources and not worried about this stigma. In addition, peers were a key source of information about resources. So they were sharing information with other folks and learning about it through their peers is how people sort of were reintroduced to the Basic Needs Center. Next slide. So what can campuses do, right, with this information? How can we support undocumented students? The first one would be collaborating with staff, faculty, and students to increase awareness of essential campus needs resources. And all of these folks can really help us get the word out, right, about the variety of resources available. Next. There's also a lot of potential interventions that can be piloted to address these operational and logistic barriers for unreached student populations. So thinking about expanding or walk-in hours that help students manage these things, increased or mobile access points, and additional food pantries across campus, prepackaged bags of basic ingredients or meal-specific ingredients. Stock updates was another thing that students were hoping to get so that they knew what would be available on the days that they had access. And then clearly stating when undocumented students are eligible or ineligible for a resource. I mean, students were very clear that they wanted to say not all students are eligible, that undocumented students specifically are eligible because they assumed all students doesn't include them. And then the last point is really increasing funding and support the expansion of centers and services.
Well, thank you so much, Matthew and Laura, and to all of our presenters for the incredible work that you're doing and your commitment to ensuring that all students' basic needs are met. We are so grateful for all you do, and I know we've all learned a lot today. We don't have much time for questions, but hopefully at least time for a few. And I am hoping I can kick us off with a first question. And this is really to all of you. What are the most significant barriers or facilitators to foster collaboration across college campuses to address basic needs in security? And I know this is a big question, but one I know you've all thought a lot about.
Could you repeat it, Heather?
Sure. What are the most significant barriers or facilitators to foster collaboration across college campuses to address basic needs and securities?
I mean, in terms of every campus has its own context, I will say, and I think that's what might make it difficult. And we're 10 campuses in one system, and I think there's some decent collaboration happening, but probably not enough. And I think the other issue, and maybe one that we've kind of identified, is that you might be doing basic needs research, but you don't consider yourself a basic needs researcher. And so it's kind of hard to find your people when you're, when you say, I research social determinants of health or something like that. And so when people are using different labels and different names, it makes it hard to find your people who you can, so who you can collaborate with.
I'll also just say, I think the collaboration sometimes needs to happen really with the students that are accessing the services. I think from our research, we really found that, you get a bunch of folks on campus that are very passionate about providing student services. We come up with systems and policies and put those in place. But then sometimes that's not really what the students want or how they would really prefer things to be structured. For a long time, we really focused on trying to reduce stigma, but may sound maybe what we were hearing from some of our students, maybe stigma's not as big of an issue, and we're as we would make it seem, and we can kind of work around that. So I think the best collaborators are sometimes the students themselves.
Okay, I thank you so much. Does anyone else want to respond to that? Okay. I am going to turn to a question. This has come in. This is for Doctors Landry and Enriquez. Is there a difference in willingness to complete an intake form for more comprehensive assistance, if there is one, for undocumented students versus directly using pantries?
So we didn't ask questions to really get at this information based on what students were sharing, right? That there were intake forms and being able to access resources. And some students reported that those forms included questions about immigration status. So I would say that in general, like in talking to staff, because we also spoke to staff, right? There's a lot of commitment to providing comprehensive assistance to all students, but also to undocumented students in particular, right? And the center is very open about that. So I think that they're doing a lot of really good work, but we weren't actually able to talk to students about intake forms. And I think in our current moment, right, this is always shifting. Maybe, 3 years ago, an intake form that said I was undocumented was fine. And I think right now it's not. From a student perspective and also from a staff and faculty perspective, that there's now a hesitance to put things like that on paper, right, and have records of it. So I think that we also in this particular population have to be really intentional around the current moment and changing practices so that we're able to pivot as needed.
And maybe we have time for just one last question, which is how you will be sharing your findings across the UC system with your campuses, but also across the system.
I can jump in. We have a science writer working for the UC Davis Center for Poverty and Inequality Research who can write policy briefs for us. So we're working on some manuscripts, scientific manuscripts to submit to journals, but then we want to turn these into policy briefs and really disseminate them in an accessible way to other campuses, to students, to anybody who might want to read about our findings. And really talk to our basic needs center about what their needs are for what they want to learn next, which is another important piece of all of this. So we have sort of a cycle going.
I agree. I think our basic needs centers were great kind of collaborators in all of our projects. And so I know we're handing off a document with some recommendations that we have based on our research and things like that. And then we similarly also have some policy briefs because, again, a lot of this work got started and funded because policymakers finally saw the need. And so now it's kind of kicking this back up to them and saying, hey, these is now the research that we were able to do based off of that work. And now I think in many ways, California is leading the country when it comes to work in this area and supporting students. So that's been pretty exciting.
Well, thank you so much to everyone. I know that we're at time, but I will direct everyone to the resources that accompany today's programming. You can find lots of information there about the projects. I also hope you will check out CEJA's website, where we will have information about these projects as well. And I will just close by thanking everyone so much and hoping that I see you at future webinars. This was our first webinar featuring research findings, and we look forward to making this a regular practice. And I will turn it over to Denise.
I will just say thank you so much. And I want to recognize we have basic needs center directors here as well, and students and policymakers. So and it's just really great to have you all here. So this recording will be available soon. Thank you to the presenters, to Dr. Bullock, to everyone who was a part of the coordination. So please stay engaged. Please apply if you're eligible for the request for proposal. And we are all available for questions via email. Okay, have a great day. Bye, everybody.